In this video, we will cover Parkinson's disease. Parkinson's disease is a chronic progressive neurologic disease affecting the brains and is responsible for control and regulation of movement. It is characterized by four cardinal symptoms: tremor, muscle rigidity, bradykinesia or akinesia, and postural abnormalities or instabilities. Bradykinesia means slow movement. Akinesia means there is no movement at all. Changes in cognition, including dementia and psychosis, can occur in some patients with late-stage Parkinson's disease. Now we'll see pathophysiology. Normally in the nervous system, there is a balance between acetylcholine and dopamine. Acetylcholine is an excitatory neurotransmitter and dopamine is an inhibitory neurotransmitter. The dopaminergic neurons in substantia nigra, which is a part of the basal ganglia that controls movements. These dopaminergic neurons release the neurotransmitter dopamine, which allows us to have accuracy with movement. In Parkinson's disease, there is decreased levels of dopamine resulting from destruction or degeneration of these neuronal cells. If they are dying, this will lower the amounts of dopamine available to our body for normal movement. The loss of dopamine stores in this area of the brain results in more excitatory neurotransmitters than inhibitory neurotransmitters, leading to an imbalance that affects voluntary movement and produces more excitatory effects to the neurons in the basal ganglia, and this leads to overstimulation. Because of this overstimulation, the patient will have the signs and symptoms of tremors, rigidity, etc. So increased cholinergic activity will be seen in this patient. Symptoms occur when affected brain cells can no longer perform their normal inhibitory function within the CNS. There are 5 stages of Parkinson's disease. Stage 1, that is initial stage. The patient will have unilateral limb involvement, minimal weakness, hand and arm trembling. Then stage 2, that is mild stage, that the patient will have bilateral limb involvement, mask-like face, slow shuffling gait. In stage 3, that is moderate disease, the patient will have postural instability, increased gait disturbances. In stage 4, patient will have severe disability. Akinesia, rigidity will be seen in this type of patient. In stage 5, the patient will have complete dependence, complete activity of daily living dependence. Patient will not be able to do anything by own. Now we'll see signs and symptoms of Parkinson's disease. Parkinson's disease has a gradual onset and its symptoms progress slowly over a chronic, prolonged course. The cardinal signs and symptoms are tremor, rigidity, bradykinesia, akinesia, and postural instability. 2 major subtypes of Parkinson's disease are evolving, that is tremor dominant and non-tremor dominant. Tremor dominant means most other symptoms are absent, only the tremors are present in this patient. Non-tremor dominant means it's akinetic, rigid and postural instability. The patient will not be having tremor, but the patient will be having other symptoms like rigidity, postural instability. Mainly the patient will have motor symptoms, tremors at rest, most common, hands, arms, legs, even lips and tongues, but it improves with movement. Pill rolling, tremors of the hands and fingers. Looks like the patient is rolling a pill between fingers and hands. Patient will have stiffness of extremities. Arms don't swing with gait. Akinesia, inability to move the muscle voluntarily. That is freeze up. Shuffling of gait. Extremities can freeze while walking. Cogwheel rigidity. When moving the patient's arms passively toward the body, they jerk or push back slightly. Bradykinesia. Movements are slow. Difficulty swallowing. The patient will have drooling. Face mask-like expressions. Sometimes the patient may not have any expressions. Patient may have coordination issues, so the patient will stoop to compensate this coordination issues with the muscles used for chewing food, swallowing and speaking. Soft or slurred speech Because of the problem swallowing, the patient will have aspiration. Other signs and symptoms that are not motor: depression, dementia, constipation, digestion slow down, loss of smell, dysphonia, the voice impairment or altered voice production, mask-like facial expressions. Patient will have poor blink reflex and wide open eyes, excessive and uncontrolled sweating, drooling, paroxysmal flushing, orthostatic hypotension, gastric problems, urinary retention, and the patient will have sexual dysfunction. Now we'll see diagnostic evaluation. Laboratory test results rarely identify Parkinson's disease. Consequently, diagnosis depends on the patient's age, health history, and presence of characteristic signs of disease. However, urine analysis may reveal decreased dopamine levels, and CT scan and MRI may help rule out other disorders such as intracranial tumor. Favorable response to a single dose of levodopa or apomorphine helps confirm the diagnosis. Now we'll see medical management. No cure, but medications can help make signs and symptoms more manageable. Goals of treatment is to control symptoms and maintain functional independence. No approach prevents disease progression. Now we'll see pharmacologic therapy. Carbidopa, levodopa, that is a combination given to the patient. Sinemet, which adds more dopamine to the brain. Levodopa is in a class of medications called central nervous system agents. Levodopa or larodopa is the most effective agent and the mainstay of treatment. It works by being converted to dopamine in the brain. Carbidopa is in a class of medications called decarboxylase inhibitors. Carbidopa helps to prevent levodopa from being broken down in the blood before it enters the brain and lessens the side effect of nausea also. And when levodopa enters the brain, it turns into dopamine. We have to teach the patients about the drugs. It takes up to 3 weeks to notice the decrease in symptoms. When beginning treatment, don't be alarmed if body fluids turn to a dark color after long-term usage. The drug may wear off before next dose and cause signs and symptoms. Next, we will use the drug entacapone. It is a COMT inhibitors or COMT, the other name is COMT. The full form of COMT is catechol or methyl transferase inhibitors. This drug is used to reduce motor fluctuation. It is used in combination with levodopa and carbidopa, that is Sinemet, to prevent the wearing off of the drug before the next dose is due. Blocks COMT enzyme that will break down the levodopa in the blood to allow it to last longer. Entacapone helps the levodopa and carbidopa work better by allowing more of it to reach the brain where it has its effect. We should not give the medication with MOA inhibitors. It will cause hypertensive crisis. Don't give the medications with high amounts of food or supplements with vitamin B6. It decreases the effectiveness of the medications. Avoid taking with high protein foods like cheese, milk, meat, etc. It will also decrease the amount of drug absorbed. Patient may have some side effects like nausea and involuntary movements. Next drug is ropinirole or Rucube. It is a dopamine agonist. It stimulates dopamine receptors, helps with improving movement. The side effects are drowsiness. That is a major side effects. Educate not to take when about to drive, cook or operate machines. Next drug is Zimetril or amantadine hydrochloride is an antiviral. It prevents influenza A. It is an anti-Parkinson's drug as well. To reduce rigidity, tremor and bradykinesia, it helps with the symptoms by stimulating dopaminergic activity in the CNS. Next, we use anticholinergic drug. Anticholinergic agents to control tremors and rigidity. Anticholinergics are substances that block the action of the acetylcholine neurotransmitter that is causing cholinergic activity at synapses in the central and peripheral nervous system. Acetylcholine is producing an excitatory effect on the neurons. Therefore, anticholinergic can be prescribed to decrease these effects. These medications are usually for younger adults who have extreme tremors, and because of the side effects, these are not given to the older adults. An example of these medicines are benztropine or cogentin. It blocks acetylcholine by decreasing rigidity. It decreases saliva, that is drooling, and it improves movements. It is not for people with glaucoma. We should not give patient with glaucoma. We have to educate the patient. Never abruptly stop taking the medicines. It increases signs and symptoms seen in Parkinson's disease. Patient may have side effects of dry mouth, so it is better for the patient to take sugarless candy or gum. There should not be any alcohol during these medications. Next medicine is rasagiline or acylate. It is an MOA inhibitor type B, monoamines oxidase inhibitor type B. It is to inhibit dopamine breakdown. It increases dopamine by stopping the activity of MOA. It improves the signs and symptoms. Educate about limiting foods with thiamine because of hypertensive crisis. The thiamine foods are aged cheese, smoked meats, that is pepperoni, bacon, and hot dogs, fermented food, beer. The patient may have to take antihistamine drugs to allay tremors. Next is nursing interventions for Parkinson's disease. First one is safety issues. Patients need to wear low-heeled shoes and avoid rubber soles. They tend to stick to the floor and can cause tripping. The soles should be smooth, not sticky. For balance, move slowly when changing positions. Rubber tip cane, that is single point, can help the patient. Education on how to deal with the freezing episodes. As we have seen in signs and symptoms, the patient may have the freeze-up. Some patients have them and they can occur randomly. For example, it can occur in the legs and it feels like the shoes suddenly become stuck to the ground and they can't move. Try to change direction of movement rather than continue going to the side, go forward. Use cane or walker with a laser. It provides a laser line on the floor that will help the patient find a landmark for when freezing episode happens and helps the patient coordinate their next step. Consciously lift the legs as in marching with each step or pretend they are walking over an object. Don't push through the freeze-up. Use handrails in bathrooms and shower, elevated toilet seat. Non-slip shoes and socks should be used to remove rugs and to make sure pets are away from feet, etc. Next, we have to manage the psychosocial issues. Autonomy is very important for the patient. Help them with locating utensils for eating, cooking, etc. There are special types of cookware for Parkinson's disease like spoons, forks, bowls, knives to maintain autonomy. Don't stress patient about activities or hurry them. Stress increases the symptoms. Wait for medication to peak so the most dopamine will be the most available time. Dress patients in shirts without buttons or zippers, easy to put on. Replace articles of clothing with Velcro and shoes that don't have to be tied. Next is nutrition. Nursing interventions for nutrition. Improving swallowing and nutrition. Avoid taking Parkinson's medication with high protein meals. For example, meats, eggs, dairy, beans, because they interfere with how the body can absorb the medication. It makes medication less effective. Monitor patients' weight on a weekly basis. At risk for weight loss because of the struggle with swallowing, chewing, depression, and hard to feed themselves due to rigidity. Needs foods that are soft, easy to swallow and chew. Provide semi-solid diet with thick liquids that are easier to swallow. provide supplementary feeding and, as disease progresses, tube feedings, promote swallowing and prevent aspiration by having patients sit in upright position during meals. Teach patient to place the food on the tongue, close the lips and teeth, lift the tongue up and then back and swallow. Encourage patient to chew first on one side of the mouth and then on the other side. Remind patient to hold head upright and to make a conscious effort to swallow to control buildup of saliva. Consult a dietitian regarding patient's nutritional needs. Nursing interventions for improving bowel elimination. Prevent constipation. Drink plenty of fluids, 2 liters per day, unless contraindicated with high fiber foods. Example, fresh fruits and vegetables. Stool softener can be given to the patient per empty order. Assess last bowel movement and bowel sounds along with palpation of abdomen. Establish a regular bowel routine. Increase fluid intake. Eat foods with moderate fiber content. Provide raised toilet seat for easier toilet use. How to improve communication of the patient. Remind patient to face the listener, speak slowly and deliberately, and exaggerate pronunciation of words. A small electronic amplifier is helpful if the patient has difficulty being heard. Instruct patient to speak in short sentences and take a few breaths before speaking. Enlist a speech therapist to assist the patient. This is all about Parkinson's disease.